Orthopedic injuries at any time are painful and inconvenient, especially the summer. A hot, heavy cast and immobility are not the goal of any vacationer. I'm Lauren Aldi, and this is your Herald Health Minute brought to you by the Cape Regional Health System. Did you know it is possible to have a broken bone and not show any signs of swelling or deformity? Knowing what to look for and proper care is so important. We spoke with our local expert, Dr. Kevin McHale, Penn orthopedic surgeon and sports medicine specialist, to get some valuable advice.
There's a couple of things that you can try to avoid, especially this time of year. One thing that we see is a lot of people may take the winter off from exercising, and they might not be quite as active, and now they're kind of reintroducing themselves into their desired activities in the summer, and they may start exercising a little bit more. The one concern is that you don't do it too quickly. You don't want to start up at the same intensity that you left off last summer. You want to kind of gradually advance your, whether it's the duration, how long the distance you're running, or the time you're exercising. You kind of gradually advance that over time, so that way you don't rush back into it and put yourself at a risk for injury that way. The other thing specifically with the summer is that if you're exercising on the beach, the soft sand, absolutely, it can be a little bit concerning as far as, maybe rolling your ankle or causing an injury that way. If you're running on the hard sand, you got to worry about those little holes the kids are digging up there. So there's a variety of things you should be looking out for. And also the traffic, too. There's a lot more people down here this time of year. And it's very important that if you're running on the streets, that you're a little aware that, it's not the winter anymore, and you need to make sure you look both ways, that's for sure. So the biggest mistake that we see that patients make when they're trying to get back to their desired sport or recreational activity is that a lot of times patients are trying to rush back a little bit too soon. And what can happen is if you rush back from an injury a little bit too early, you put yourself at re-aggravating that injury, and it can lead to a much more lengthy delay in getting back to your desired sport. Or you could actually injure something else and put you at risk for staying out even longer. So a typical rule of thumb that I advise patients to follow is that you should have at least painless, full range of motion of that affected joint or extremity, and at least nearly the same strength that you had before you got hurt, before you get back to your desired activity, to try to prevent that risk of re-injury or injuring something else.
Ice and rest anytime an injury is suspected and seek medical care. For more Herald Health and Wellness reports, visit the Cape May County Herald.com and click the Lifestyle tab. This health video has been brought to you by Cape Regional Health System. For more information on services and for a healthier life, call 609-463-CAPE.